Now I'm going to talk about the nerves of the upper limb. These nerves comes from a plexus which is called as brachial plexus. The brachial plexus is formed by the spinal nerves. Introduce you to a spinal nerve, I have got this model here which is showing in the yellow the spinal nerves coming out from intervertebral foramen. There are 31 pairs of spinal nerves, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. The spinal nerve from the C5 to T1, they are coming and joining together. In the area of C5, 6, 7, 8, and T1 is going to join to form the brachial plexus. After exiting the intervertebral foramen, they divide into a ventral ramus and a dorsal ramus. It's the ventral ramus which is going to join to form the brachial plexus. Spinal nerves originate from the spinal cord via the ventral or the anterior root and the dorsal or the posterior root. Posterior root contains a big ganglion which is called as posterior or dorsal root ganglion. The two roots meet together to form the spinal nerve. The spinal nerve exits through the intervertebral foramen to form the brachial plexus. The brachial plexus is formed by the ventral ramus of C5, 6, 7, 8, and T1. Plexus means braiding, and the advantage of braiding of these spinal nerves gives a muscle segmental origin from different levels. If there is a problem with one single nerve, the muscle becomes weak but does not paralyze. C5, C6 roots join together to form the trunk, upper or the superior trunk. C7 ventral rami stays alone and forms the middle trunk. C8 and T1 join together to form the lower or the inferior trunk. So we have got 5 roots and 3 trunks. Trunks are named according to anatomical position, upper or superior, middle and inferior, or the lower. Each trunk then divides into anterior division and a posterior division. So we get total 3 anterior divisions and 3 posterior divisions. Anterior division of the upper and the middle join together to form the lateral cord. The anterior division of the lower trunk stays on its own and forms the medial cord. Posterior divisions of all the trunks join together to form the posterior cord. So we have got 3 cords, and they are named according to the relationship of the second part of the axillary artery. Lateral lying on the lateral side, medial lying on the medial side, and the posterior cord lies on the posterior aspect of the axillary artery. From these cords, we get the 5 main branches. There is several smaller branches, but the 5 major branches which are going to supply the main flexor or the extensor compartment of the upper limb. There is M formation by the lateral and the medial cord. If we follow this M, the lateral side of the M is formed by the musculocutaneous nerve with the spinal level coming from C5, 6, 7. Contribution is given from the lateral cord and the medial cord to form the median nerve, which is C5 to T1 spinal levels form this nerve. The ulnar nerve comes out from the medial cord, and this is the configuration of the M formation. From the posterior cord, we get the formation of two major nerves. The biggest nerve is the radial nerve, nerve of the extensor compartment, and the fibers originate from all the levels from C5 to T1. Axillary nerve is the smaller branch from the posterior cord and contains the fibers from C5 and 6. So there is a formula here which goes from the formation to distribution: 5 in the beginning, 5 in the end, 3 in the middle, and 6 in the center. 5 roots, 3 trunks, 6 divisions, 3 cords, and 5 terminal branches. Now I'm going to show you the formation of the brachial plexus on this prosection. Just to identify some of the major areas here in the neck, this muscle here is scalenus anterior. The muscle which I'm showing by the probe is scalenus medius, and this area here is the superior surface of the first rib. These three structures, they form the interscalene triangle. The brachial plexus emerges in between this triangle. So here is the base of the triangle, anterior border of the triangle, and the posterior border of the triangle. Through this triangle, the roots of the brachial plexus are coming out. Now I'm pointing to the ventral ramus of the C5, C6, C7, C8, and hidden underneath the artery is the T1. These ventral rami, then they will join to form the trunks. C5 and C6 will join to form the superior trunk or the upper trunk. C7 will continue on to form the middle trunk. C8 and T1 will join to form the lower or the inferior trunk. The trunks are named according to the anatomical position: superior, middle, and inferior. Trunks then divide into divisions. Each trunk divides into an anterior division and a posterior division. Anterior division and a posterior division. Anterior division and a posterior division. Divisions are functional divisions. All the anterior divisions supply the flexor compartment of the arm, forearm, and hand. All the posterior divisions supply the extensor compartment of the arm, forearm, and hand. Anterior division of the upper and the middle trunk join together to form the lateral cord. Anterior division of the lower trunk forms the medial cord. All the posterior divisions join together to form the posterior cord. The cords are named in relationship to the axillary artery. Here is the axillary artery, and in anatomical position we can see the lateral cord is on the lateral side, medial cord is on the medial side, and posterior cord is hidden on the posterior aspect of the artery. After the cords, we find the terminal nerves or the branches. There are 5 major branches. To see the major branches, we look at this M formation. You can see here the M formation. This is the musculocutaneous nerve, the median nerve, which is formed by the contribution from the lateral cord and the medial cord. And this is coming straight from the medial cord is the ulnar nerve. From the posterior cord, we see 2 major nerves, axillary nerve going into the axilla and the radial nerve. This is the biggest nerve of the extensor compartment of arm, forearm, and hand. Coming from the superior trunk, we see the suprascapular nerve. The suprascapular nerves through the suprascapular foramen and will supply the supraspinatus and infraspinatus muscles. Coming straight from the roots is the long thoracic nerve. The long thoracic nerve lies on the lateral side of the chest wall, and we can follow this nerve all the way branching into the serratus anterior muscle. Now, serratus anterior muscle are these finger-looking projection which we see on the anterior part of the chest wall, and you can see here. This is the muscle which is supplied by the long thoracic nerve. Another nerve which comes from the posterior cord, here's the posterior cord. We can see this nerve coming down to supply this muscle which is latissimus dorsi. We can see the branching of this nerve which is supplying the latissimus dorsi muscle. Now I am going to demonstrate some of the compression site for the brachial plexus. The first area is the intervertebral foramen, which is hard to see in there, but these ventral rami are coming, or the spinal nerves are coming from the intervertebral foramen, and a prolapse of the disc can compress these roots, C5, C6, C7, C8, or T1. The second compression site is interscalene triangle. Interscalene triangle is the scalenus anterior muscle, scalenus medius muscle, and the first rib. This triangle can get compressed by an extra rib, which is called as cervical rib. And the cervical rib usually compresses the C8 and T1 roots. The third area where it can be compressed is called as costoclavicular space, My probe is representing the rest of the clavicle, which is taken out here. There is the first rib and the second rib. You can see the brachial plexus coming out from the neck into the axilla. This area is the costoclavicular space where my finger is. That's another area where the brachial plexus can be compressed. Last space is between the pec minor muscle. Here is the pec minor and the tip of the coracoid. This area of the brachial plexus can be compressed in this place.